Hi, my name is Jerry Harden. I work with a company called Pritchard and Jordan, and we have been the employee benefit brokers working with NOC on your employee benefit programs for the past 10 years, since about 2004. I've met many of you at either at training when you were in town here at various times, or for some of you maybe in your stores. But today, Adam and Loda asked me to give you an overview of the upcoming open enrollment period for 2014, and also some of the details that led up to the decisions and changes that will be made for 2014. And I'll apologize in advance. I'm going to, for the sake of expediting this and taking up less of your time, I will read from this, but I will also try to elaborate where necessary. The logistics of the open enrollment period, it will begin on this week, on this Wednesday morning, and which is December the 11th, and it will run for 1 week and 1 day, closing at the end of business on next Thursday, December the 19th. Because this was a particularly challenging year renewal-wise, and we took a lot of time trying to get negotiated as strongly as we could with carriers, and Intimacy's management took some time to finalize their decisions. We are cut short on the enrollment time, and so we are going to be using paper enrollment this year instead of the online tools that we used in the past, because there simply wasn't enough time to set them up and test them to make them operable and reliable for this enrollment. So we will be using paper. We're going to have a simple election form. Adam will distribute that along with the plan information and changes and premium costs in an upcoming email very shortly. But you would just complete the paper and turn it back in to your individual store manager prior to or by the end of the deadline for next Thursday. The only thing I would ask is that you try to make your handwriting legible and make sure that you provide all of the required information so we don't have to spend additional time tracking you down after the fact. To talk about the actual 2014 renewal and kind of what went on behind the scenes with it, it was almost like a perfect storm, to borrow a line from the movie. There were a number of things that really contributed to a catastrophic outcome. The first thing that contributed some was this was our first year with a new carrier, Cigna. We made a change from United Healthcare, who we've been with for several years, a year ago, and that was a good decision. It did save a considerable amount of money, and it certainly provided comparable benefits. Cigna's done a good job. It's just that they entered into it expecting to make some money, and in a bad renewal cycle, which we'll talk about in a moment, that has not occurred yet. So they've got to have a reasonable renewal to allow them to continue business. The second thing was, this is the first major year of the implementation, finally, of healthcare reform for 2014. And so there are a number of costs and fees and benefit changes and a whole host of regulatory changes that the insurance companies have had to deal with, all of which adds cost. To give you an example, just the additional taxes and fees that Intimacy has to pay in premiums that are paid to Cigna and then passed through to the federal government to finance the Affordable Care Act, were 3.7% of the entire premiums for 2014. $35,000 a year that adds to the cost. That hadn't been there in the past, but it will be there going forward. A third thing is, and the major contributor to the heavy renewal increase this year, was the actual claims versus premiums that Cigna paid out and took in respectively. To give you an example, from January when the Cigna plan started through the end of June, Cigna took in about $320,500 of premium. For that same 6-month period, just on the top 5 claimants that were in the intimacy group this year, they paid out 110% of that. And that was only on the top 5 people, or the 5 most expensive people, if you will. So the claims experience was not very good. They actually had incurred claims of 250% of the premium, and certainly it's hard for anybody to make money that way. So when the renewal came out, they needed a 149% rate increase based upon Intimacy's actual claims experience, and they knew that wasn't going to happen, couldn't happen, but they don't calculate the renewal really that way. They did show it to us, but the actual calculation called for a 52.6%, which because they blended it with comparable other groups of intimacy size and makeup. So the risk is spread amongst all the groups to some degree and not just all borne upon intimacy's claims. Well, that helps a lot to get the renewal down to 52%, but at the same time, that's still a huge increase. So we continued to negotiate on some other points. Bottom line is we finally got the renewal down to a 40% increase, and that's as good as we could do. To put that in a little perspective market-wise, we went out, as we always do each year, to all the other competitors in the marketplace, and of all the major carriers, all the rest of them except one declined. Didn't even give us a proposal this year based on the claims experience. And that included Blue Cross, United Healthcare, which we'd been with before, Aetna, and Coventry. The only one to give us a renewal at all, or a proposal at all, was Humana, and they wanted 113% more than the current Cigna rates, as compared to the 40% renewal with Cigna. So they were nowhere near competitive. So hopefully 2014 will turn into a better year. We'll see those severity and frequency of claims go down some, and hopefully it'll be a better year, a more stable year for healthcare in this country as well, as we work our way through the first year of healthcare reform. We did wind up saving 2% on the renewal by agreeing to transfer your dental, life, and disability insurance coverages from MetLife to Cigna to give them more premium, and in turn they gave us a 2% medical reduction on the medical premium, rate reduction on the medical premium, and that equated to a savings of about $19,000 a year. So that was very worthwhile. MetLife couldn't respond comparably because they're not a medical carrier. So you won't see any coverage differences or premium differences, but you will note that your dental and life and disability coverage is now with Cigna, and that's the reason why. Also, going in 2014, Intimacy has in the past paid 50% of the total premium for dental coverage, whether you had single coverage or whether you chose dependent coverage. And they pay 100% of the premium for your basic employee life insurance, group life insurance program, and your short-term disability program. And the good news is they will continue to subsidize those programs at the same rate again this year. So you won't see any additional cost as a result of that. Intimacy also currently pays about 60% of the medical premium for single coverage and about 40% of the dependent coverage premium. For 2014, and again partially due to healthcare reform, Intimacy is going to be changing that contribution formula to help it comply with some of the additional laws, which now require that the single premium pass an affordability test, and they will now contribute a flat $270, which is 20% more than they currently contribute for single coverage. So they are increasing their contribution, but unfortunately, because of the size of the overall renewal increase, we'll still all see a contribution increase for single coverage and a big contribution increase for family coverage because there's no longer the same level of subsidy. So expect that. In order to provide some lower cost options to hopefully help offset that for people, at least give them some more choices, they're going to offer 3 different medical plan options this year, kind of a high, medium, and low option approach, if you will. And they wanted to get a plan that was going to at least be an affordable catastrophic plan so that if you so elect, you do have that option. And so this year, 2014, in January, they're going to have a high option plan that will be very similar to your current high option coverage. It'll have a $1,500 deductible, 80% coinsurance, $4,000 out-of-pocket maximum, have your same $25 and $50 office visit copays for primary care and specialist visits, and your same prescription drug copays, very similar to your current plan. The middle option will be a $2,500 deductible plan with 80% coinsurance and a $5,000 out-of-pocket maximum with no office visit copays or prescription drugs. You must meet your deductible before having any other coverage except for preventive care. It does cover preventive care at 100%, no copays required, no deductible to be met. And then the low option plan this year will have a $4,000 deductible, 70% coinsurance, and a $6,350 out-of-pocket maximum. And again, you have to meet your deductible before any other coverage for the plan would respond with coinsurance payments. Except for preventive care, again, it covers preventive care 100%, the same as each of the 3 options do. And that low option plan is actually the lowest benefit and premium plan that Cigna can legally offer Intimacy under the new healthcare reform guidelines. So Adam will be sending out an email with attachments that describe the various plans and plan cost along with all the required forms. As an eligible employee, you must complete all the paperwork, either electing coverage or waiving coverage as the case may be. If you do not turn in any paperwork, you will automatically default to that which you already have. If you have single coverage for medical, high option, that's what you will keep going forward. If you cover your dependents, you'll cover your dependents going forward. If you waive coverage going forward. So it is important to turn in the paperwork, and particularly to affect any changes in what you currently have. Also, for 2014, all Intimacy medical plans will maintain minimum coverage requirements. They meet the ACA guidelines for minimum coverage, and they even collectively meet the ACA guidelines for affordability as well. Because they do they are compliant with the ACA, no Intimacy employee who is eligible for medical benefits, works full-time, is eligible to purchase coverage from either any state or federal exchange, whichever is in place where you live, and you do not qualify for any federal premium subsidy for that coverage. So, and that's because you have affordable minimum coverage as specified by the ACA guidelines sponsored through your employer. However, those of you who do not cover your dependents on the Intimacy plan, you may have the option to purchase coverage for your dependents on the federal or state exchange where you live. And you may even qualify for a premium subsidy on that dependent coverage. So it is something that you may want to go out there and take a look at. As far as other considerations, there's another provision of the Affordable Care Act, which is called the individual mandate, and that is an individual tax penalty which penalizes us, those people who do not have health insurance in 2014, or they elect not to pursue health insurance. And therefore, the federal government is going to provide a disincentive for you to take such action, and they're going to penalize you in your upcoming 2015 taxes. So the tax penalty will equate to the greater of either $95 per uncovered adult and $47.50 per uncovered child for up to 3 children in our household, or 1% of our household income to a maximum of $285. That tax would be split up on a pro rata monthly basis for anyone in the household who was uncovered by health insurance. And they would collect that money when we file our 2014 tax return in early 2015. And if you don't have health insurance coverage, there'll be a line on your taxes that collects and charges you that tax penalty. It also gets worse. The penalty doubles in 2015 to $190 per adult, or 2% of household income, and then it goes up another 1.5% in 2016. So it's gone from 1% to 2.5% over 3 years. And that's the government's way to try to incent you or disincent you to make sure you have or acquire medical insurance. I can tell you the importance of it personally. I had 2 personal experiences with it this year that hit my family. And the first one was on me. I had some medical tests done this past quarter unexpectedly, and the cost of those tests was upwards of $6,000 had I not had insurance. My medical insurance reduced the portion they would pay for it down from $6,000 to $3,000, and then my deductible and co-insurance, part of mine was about $1,000 out of pocket, and the insurance company covered the other 2. So I went from having possibly $6,000 plus down to about $1,000 of out-of-pocket expense for my deductible and co-insurance. My son-in-law had an even more dramatic situation where he broke an ankle, had severe complications, life-threatening complications with blood clots that formed from it, moved up to his chest, passed out, made him unconscious, was rushed to the hospital, spent several days in intensive care, heavy medication trying to bust up the clots, and then another 5 or 6 days in the hospital beyond that. His medical bills for all of that totaled over $250,000 for an accident resulting from throwing a baseball, and completely unforeseen. And fortunately, he has recovered. He's still with us. We didn't lose him in the process, which we easily could have. But he did have insurance through his employer, and that probably made a difference between him having $4,000 out of his pocket, unexpected, to $250,000 if he hadn't been insured, and probably having to declare bankruptcy or possibly lose their home or their cars or whatever else, so be in debt for years and years. So it is important to have at least a level of catastrophic coverage, and then from there you can opt up as your income and other demands allow. So that's a little bit about the open enrollment process and what you can expect and the plans that will be offered. And so I'd like to kind of close with some good news. And that is that Intimacy, for the first time, is going to offer 2 brand new programs for you. The first of which is generically called telemedicine. And the carrier that will deliver that for us is called My Ideal Doctor. They are a telemedicine company that Pritchard and Jordan offered to our own employees this past July. I've used it. It works great. And it basically makes doctors available to you on a around-the-clock basis, 24 hours a day, 7 days a week, 365 days a year. And they're available by calling an 800 phone number or by teleconferencing on the video on the computer online. And they can diagnose and treat us over the phone or over the computer, as the case may be. And they are not quacks. They are licensed, board-certified physicians with a medical license in your state of residence. So they fully comply with all the required laws and medical laws. They can diagnose about 70% of everything you see a doctor for. All the normal day-to-day stuff, colds, flu, accidents, minor emergencies, sore throats, skin rashes, stomach aches, etc. They'll help you stay out of the emergency room, out of the urgent care centers, even out of the doctor's offices, and instead you can have your care quicker and at no cost to you whatsoever. NMSE is going to pay the full cost of that program premium-wise for you and for all of your dependents. So there's not even a copay involved. So it's an excellent way to get the required medical care you need, get it quickly, even get the prescriptions associated with it, and drop them off at the pharmacy or just have the doctor call them into your pharmacy and then just go by and pick them up. So it's an excellent benefit, an added feature of which is that it doesn't expose you to all the germs that you're normally exposed to in a doctor's office or a hospital. So we've used it with a lot of success in our family, and I really encourage you to try it. NMSE is very excited and pleased to be able to offer it to you. A final item that they will offer this year is a premium subsidy, not a premium subsidy, an actual membership subsidy for you to possibly join any kind of a gym membership that you might choose to. And they will have a specified amount that they will contribute towards the cost of a gym membership for you if you are so inclined. And that benefit will be delivered through an outfit called Global Fit. And unfortunately, all the details of that are a little bit up in the air as they are changing as we speak a little bit. So as soon as we finalize those benefits, we will have Adam send them out to you so that you can take advantage of that new benefit as well. But the idea is to make it a little more affordable for you to proactively take control of your own health care, your family's health care, to do a little more exercise, be a little healthier in 2014, and therefore to hopefully help us impact the long-term medical costs going forward. So that's about it for my enrollment overview. I appreciate your time and attention, and look forward to sharing with you a happy holiday season, and certainly wish you the best in a healthy and prosperous 2014. Thank you. Bye.